Good morning. Today we will be discussing a very important topic, that is hemoptysis. First of all, what is hemoptysis? It is defined as expectoration of blood from the respiratory tract. Basically, we have to differentiate it from hematemesis, epistaxis, or hemoptysis from other areas, which is known as pseudohemoptysis. What is the source of hemoptysis? It can originate from anywhere between glottis to alveolus. However, the most important site of hemoptysis is bronchi. As we know that lungs have due blood supply. Lungs are supplied by bronchial circulation as well as pulmonary circulation. What is bronchial circulation? This is a high pressure circulation. It originates from aorta and it comes under systemic pressure. It supplies the airways. And the pulmonary circulation is a low pressure circulation and it aids in gas exchange. The hemoptysis is most commonly originates from bronchial vessels. Now we will discuss the etiology of hemoptysis. There could be various causes of hemoptysis. First important cause is infections. They could be viral, bacterial, and others. Bacterial causes are Streptococcus pneumonia, Haemophilus influenza, Moraxella catarrhalis, Mycobacterium tuberculosis. TB is a very important cause in India. How it causes hemoptysis? It causes hemoptysis from the cavity itself and also from Rasmussen aneurysm. Other causes are endemic fungi, Nocardia, Aspergillus species. Other bacteria which cause hemoptysis are Staph aureus, Klebsiella pneumonia, and oral anaerobes. Paragonimiasis is an also important cause of hemoptysis. What are the various vascular causes of hemoptysis? They are pulmonary embolism, AV malformation, rupture of aortobronchial fistula, diffuse alveolar hemorrhage, and pulmonary renal syndrome. What comes under pulmonary renal syndrome? One causes granulomatosis with polyangiitis, other is antiglomerular basement membrane disease. Third important cause is malignancy. Now it could be bronchogenic carcinoma, carcinoid tumors, or metastasis from distant sites like melanoma, breast carcinoma, colon carcinoma, and other causes Kaposi sarcoma. And could be few other causes like mechanical and other causes, in which we have pulmonary endometriosis. In that you have hemoptysis during menses. This is known as catamenial hemoptysis. Then another cause could be foreign body aspiration, thrombocytopenias, coagulopathies, diagnostic and therapeutic procedures, and anticoagulation or antiplatelet therapy. Now, how you are going to proceed with this patient? First of all, we have to take the proper history of the patient. In that, we'll ask about the bleeding. What was the amount of the bleeding? How much was the severity of the bleeding? Whether there was any history of smoking, fever, cough, loss of appetite, or loss of weight. Then we'll do physical examination of the patient. First of all, we'll examine the nasal and oral cavities to see if the cause of bleeding was located there. Then we'll see for patient's breathing pattern to assess whether the patient is in respiratory failure or not. Then we can look for clubbing to rule out bronchiectasis. Then we have to rule out bleeding diathesis by looking at the skin to look for any petechiae or ecchymosis, etc. Then what diagnostic studies we'll perform for this patient? We'll get blood tests done. First of all, we'll get CBC to rule out any infections, anemias, thrombocytopenias. Then we'll get LFT, RFTs, and we'll get urine analysis done in case of the if we are suspecting pulmonary renal syndromes. Then we'll get chest imaging done. In that, we can get chest X-ray and CT chest done. However, if we are suspecting pulmonary embolism, then we can get CTPA also done. We can send samples for sputum evaluation, and in the end we can do flexible bronchoscopy to see the site of the bleeding. What are the interventions we'll do? Whenever there is bleeding, first of all we have to protect the non-bleeding lung. Then we have to locate the site of the bleeding and we have to control the bleeding. This is an algorithm which shows if the patient presents to you with hemoptysis, what you will do. First of all, we'll take the history of the patient and we'll physically examine. If the hemoptysis is massive, then we have to protect the airways. If the bleeding stops, then we don't have to do anything. If the bleeding continues, then we have to perform embolization or resection. In case of non-massive, if there are no risk factors, we have to treat the underlying cause. In case of risk factors, we have to go for investigations and blood profiling. Even if there is persistent bleeding, we will continue to do CT scan. After the CT scan, we'll get bronchoscopy done and we have to treat the underlying disease. However, if the bleeding still persists, we have to go for embolization and resection. We do bronchial artery embolization, but its most common complication is anterior spinal artery block. Thank you.